Today, inshallah, we're gonna talk about zeldox. What is it? What is it exactly, and what's its chemical characters like active ingredient, concentration, forms, bioavailability, metabolism, excretion? What about alternatives in Saudi Arabia, Egypt, and other countries? Uses side effects, how to minimize side effects, drug interactions, and we will answering the most frequent asking questions like the detailed mechanism of action for zebracidone doses, initial doses, and maximum doses. Zebracidone class, is it a strong, is it sedative? What about its effectiveness? What are extrapyramidal syndrome or extrapyramidal side effects of zebracidone? Zebracidone and lactation, the best time to take zebracidone. Does zebracidone make you gain weight? So let's go. In the name of Allah, the most gracious, the most merciful, blessing and peace be upon the master of our sales, Muhammad, peace be upon him. Zeldox. Active ingredient for zeldox, it is called zebracidone, and it comes in a lot of concentration, 20 milligram, 40 milligram, and 60 milligram. Forms, capsules, and injection in muscles. Muscle IM, okay? Bioavailability, always brand is better than any generics. Metabolism only in liver, excretion in urine and feces, okay? What about alternatives in Egypt, Saudi Arabia, and in other countries? There are no alternatives in Egypt and also for in Saudi Arabia. In other countries, Jidon and Zipol. Okay? Zeldox uses. The main uses for Zeldox is schizophrenia, especially schizophrenia with negative symptoms, bipolar disorder, especially bipolar type 2, and it is used also for acute agitation, especially IM injection. IM injection, amazing, astonishing result for acute agitation. What's about zebracidone side effects? On CNS medications, headache, anxiety, and restlessness. On GIT, only constipation. What about its effect on weight gaining? The least amount of weight gaining zebracidone. The least amount at all is zebracidone. You have to take this point in your mind. Okay. What about its sexual dysfunction? No sign of sexual dysfunction at all. Okay. Drug interactions. The most famous drug interactions on CNS depressant, we have to avoid use it with CNS depressant and with levodopa and dopamine agonist. With levodopa and dopamine agonist, we have to avoid using zebracidone. Let's go to the most frequent asking questions. What is it, the detailed mechanism of action for zebracidone? Zebracidone act as antagonist for D2, 5-HT1D, 5-H2A, and agonist on 5-HT1A. Okay? If you want to know more about detailed mechanism of actions and these abbreviations, just write down in comments. Okay? Zebracidone doses. Zebracidone doses for bipolar disorder, 20 milligram and maximum dose 40 milligram. For schizophrenia, 60 milligram and the maximum dose is 80 milligram. Okay? Zebracidone class. Zebracidone is antipsychotics from the second generation antipsychotics, which is called atypical antipsychotics, not typical antipsychotics. Okay, is it sedative? No, Zepoxidone not sedative, so you can use it morning time and evening time. Is it a strong or weak antipsychotics? To be honest, it is a moderate action. Moderate antipsychotics. Not strong, not weak. What about its effectiveness? Zepoxidone is higher than lorazepam and iloperidone, equal to chlorpromazine and acinabine, lower than quetiapine, olanzapine, haloperidol, and aripiprazole. If you want to know more about all these antipsychotics, you will find complete comprehensive review, but in Arabic, in the second channel. We have already more than 1,000 videos about CNS medications and bipolar disorder in our second channel. What are extrapyramidal side effects for zebracidone? The most famous uncontrolled body movements, muscle stiffness, and restlessness. What about zebracidone and lactation? Not enough studies. Not enough studies. But the safest antipsychotic in lactation, olanzapine with brand name Zyprexa and quetiapine with brand name Sertraline. Okay? The best time to take zebracidone. Zebracidone, it is used 2 times per day, BID, morning and evening. Morning and evening. Does zebracidone make you gain weight? No, at all. The least at all. That is it for today. If you have any question, just write it down in comments and I will answer you during 25 hours. Bye bye for now.